Hospitals are places of healing, but sometimes patients catch infections when they're there, and it's always better to prevent an outbreak in a hospital than scramble to treat an infection.
And that's why two professors at Pitt's Med School wanted to find a way to monitor for outbreaks and developed a system that is the first of its kind at any hospital in the nation. Every hospital has outbreaks of infections like MRSA.
Some of these are very, very serious, like bloodstream infections, pneumonia, urinary tract infections.
Those can be deadly to patients already battling serious health conditions.
They're very hard to treat, difficult to treat infections that antibiotics typically don't work on these. And these are the pathogens that we're interested in stopping.
And when trying to prevent outbreaks, it's important to know where they're coming from. At UPMC Presby, that's when the doctors turn to ED's hat.
ED's hat improves patient safety.
It's not an actual hat. ED's hat stands for Enhanced Detection System for Healthcare-Associated Transmission.
So if you're in the hospital for a few days or more and you get an infection, we go to the laboratory, get those bacteria, and we sequence them. And that turns on the light in the hospital.
The platform was developed by doctors Alex Sunderman and Lee Harrison, both professors of infectious disease at the University of Pittsburgh School of Medicine.
So it's very gratifying. You detect these outbreaks, you figure out what's causing them, and then we stop them in their tracks.
Using genomic sequencing, data mining, and machine learning, it quickly identifies whether patients' infections share similarities, when before an outbreak would have gone unnoticed, like when multiple patients in unrelated units were getting infections.
These 10 patients were on 8 different nursing units, so nobody identified the outbreak. The sequencing, the genomic surveillance did that. And then we determined that there were procedures being done in interventional radiology that were causing the outbreak.
The source was tracked down and stopped.
We get reports of new outbreaks every week, and we investigate the new outbreaks every week.
The professors say the fact that the system is detecting these outbreaks at UPMC Presby is a good thing.
Here at UPMC Presbyterian, we are actively looking and we're finding them and we're stopping them, which is unique to any other hospital in the U.S.
During the course of a 2-year study at Presby, the system prevented 62 infections and 5 deaths.
It's been amazing. It's like walking into a room and turning on the light. Using old methods, we don't see all these outbreaks, but you do the sequencing, all of a sudden these outbreaks become totally apparent.
The professors say, along with preventing infections and protecting patients at Presby, they have a lot of things they want to try with ED's hat.
We are starting to expand towards COVID and RSV and influenza to see if we should include those respiratory viruses in ED's hat as well.
Will this work in a children's hospital? Will it work in a community hospital or a rural hospital or a skilled nursing facility? These are all the other questions that remain on the table, and we truly think so, yes. Yes, it will work there.
With federal cuts to funding and staff at the CDC and National Institutes of Health impacting scientific research across the country, these disease detectives at Pitt say their role is to keep doing the science and keep finding the evidence to protect their patients.
We know that we are giving the best care to our patients, we're preventing these infections, we're saving lives, and we're going to keep pushing that forward, however it may be able to get expanded.
Now, in addition to saving lives, Dr. Harrison and Dr. Sunderman found the ED's hat system saves money. Treating a single hospital-acquired infection in a patient can cost as much as $25,000. Over the 2 years of the study, their outbreak monitoring system saved more than $700,000 for patients on infection treatment costs.